Another important thing is to prevent cross infection. Elderly are more prone to catch infections, and hospital acquired infections can be very dangerous because many of the bugs in the hospital are multi drug resistant and resistant to multiple antibiotics, and it can prove very dangerous. It is particularly important that the nurse adopts measures to prevent infection, like frequently washing hands, sanitizing the hands before touching the patient. And she also educates the bystanders and all the visitors in complying with this so that the patient does not catch an infection while in the hospital. Bed sore is another dreaded complication in the elderly, and elderly are more prone for bed sores because their skin is more fragile, and overall their fragility will tend to increase the chances for breakdown of the skin, which can lead to the bed sore. Nutrition or the lack of nutrition, which is not often thought of as a cause for bed sore, is very important. That sufficient amount of proteins is required for the patient in order to maintain the integrity of the tissues, including the skin. So as as much of protein as is allowed for the patient by his medical condition should be provided for the patient. Early ambulation also helps in preventing bed sores. The nurse encourages the patient to change position frequently, hourly or so, so that there is no pressure at one point which can lead to skin breakdown. The nurse also takes particular care in while changing the sheets so that shearing force does not cause disruption of the skin. She also makes sure that appropriate mattresses are used. And these days, special mattresses are also available, like air beds, etc., which also reduce the chances for bed sore formation. It is also important that the skin does not remain wet and macerated. So, uh, if the sheet gets wet for any reason, it has to be changed. Also, absorbent sheets can be made use of to keep the skin dry. And apart from regular skin care for the patient, where the skin is, wiped and uh, powder or emollients are applied as is necessary to keep the skin in the right state of hydration. The nurse also frequently inspects or examines the patient for the development of any bed sores and brings it to the attention of the rest of the team so that it can be managed appropriately and early enough before it gets worse. Aspiration is another problem with the elderly, where food items or fluid can go into the air pipe and into the lungs, leading to serious pneumonia. Therefore, the nurse takes particular care while feeding the patient in the proper position and allowing the person to chew and swallow each morsel before uh, the next morsel is given. Prevention of injuries during hospitalization is also a very important thing because older persons are much more prone for injuries, and injuries can be more severe in case there is a fall, etc. Therefore, uh, the nurse keeps a very close watch on the patient. Uh, Hospital beds often have railings on both sides, and the idea is to prevent patients from falling off. But sometimes the railing can cause more problems. If the person is agitated or disoriented, he or she might get entangled within the limbs of the person can get entangled in the railing, and that can cause injury. Sometimes the person in an agitated state can climb over the railing and fall off from a greater height. So nowadays the current recommendation that is that it is better not to have railings, but have the bystander, somebody with the patient always, to see that the person doesn't fall off, and that or even if the person does fall, some mattresses or cushioning can be provided so that the person doesn't injure himself. So the height of the bed also can be kept low so that injuries do not happen. We sometimes see in hospitals patients who are agitated, they tie up the hands. That is not a good thing to do at all. And it is ethically considered inappropriate, and as far as possible, one should avoid it, um, and try and get the patient to comply um, by other means. Sometimes patients pull out their IV lines or nasogastric tube, so their uh, hand is gloved with a bandages so that they don't pull out things. Again, these are measures that should be used only if there is no other alternative, and overall the benefit and the harm that it does to the patient should be weighed. Then, as the patient is nearing discharge, the nurse plays an important role in educating the caregivers on how to take care of this person once the person goes home. Uh, Overall, in terms of medication, in terms of the exercises, and in terms of feeding, all those things, the nurse plays the most important role in preparing the patient and the bystander for discharge. The other settings in which gerontological nurse plays an important role is in the home setting, where the pays a lot of attention to safety issues with regard to the environment in which the person lives. Are there any issues there? We will be talking more in detail about safe environment for the older person in another episode. Similarly, behaviors that can lead to injuries also is something that the nurse will look for and try to correct. Sometimes a person may need an enema or a manual removal of the stools in case it gets impacted. So in geriatrics, we always try not for the patient not to get constipated and passes stools every day. But should this happen, the nurse plays an important role in helping with that. It is important not to give strong purgatives, because if the stool is impacted, it can cause a tear in the rectum. So in such situations, it is better to give an enema and remove the stool manually if necessary. So with that, I conclude this episode on the role of the gerontological nurse. In my next episode, I shall be talking about the role of the physiotherapist in the team. Goodbye till then.